Good afternoon, everybody. Steve Schmidt with The Warning, and thrilled to be joined again by Dr. Angela Rasmussen of Rasmussen Retorts with a T, retorts, not reports. Dr. Rasmussen, how are you?
I'm doing great, Steve. How are you?
I'm doing well. You have a new piece out on your Substack, and it is not optimistic, to say the least, about the state of the nation's public health agencies, chief amongst them, the Centers for Disease Control.
Yes, that's right. So Friday, this has been an eventful weekend. It's Thanksgiving weekend here in Canada, but it has not been filled with gratitude from me. That's for sure. On Friday night, I started to get text messages from my colleagues who work at CDC, letting me know that people were starting to get these reduction in force or RIF notices across the agency. And as it turned out, 4,000 employees roughly were cut from the federal government. There were a lot from other departments as well. So, Treasury, for example, was heavily affected, but there were 1,100 people that were riffed from HHS, and the vast majority of them were at CDC. And judging by the entire groups that were riffed, so the office of the director at many of the major centers within CDC. So CDC is actually a collection of a bunch of different centers that all do different things. The entire offices of the directors at a number of these centers, including the NCIRD, which is in charge of immunization and responding to respiratory disease outbreaks, NCEZID, which is responsible for basically all other outbreaks, chronic disease, injury prevention, global health. All of these had their offices of the director cut with all accompanying staff. And so this meant that basically a lot of the functions of these centers are no longer going to be able to be carried out. Now, they reported on Saturday then that some of these RIFs had been revoked. And some people have gotten notices saying that they were riffed, quote, in error. But it's not really clear how many of those people were riffed in error and how many of them are actually going to get notices that their riffs are revoked. So it's really unclear how many people are actually going to be lost from the CDC. But the important thing is there's still probably hundreds of employees who will be. And these people are not just sitting around pushing papers. They're actually doing really important things in terms of tracking data about diseases, in terms of responding to disease outbreaks, in terms of containing infectious disease outbreaks. And those people are no longer going to be able to do their jobs, and there's really nobody to replace them. So we're going to actually lose that capacity as a nation, and it's pretty terrifying.
Okay, so I want to go down a road with you today a little bit that merges politics and public health, and see where it goes. But let me before we get into it, I just want to ask a basic, simple question. So what? No more public health service. I'm gonna adopt, for the sake of argument, just I'm exhausted by it. I don't want to talk about it anymore. I don't want to talk about the masks. I don't want to talk about the vaccine, Operation Warp Speed. My position is now, for the sake of argument, fuck it. You people win, right? Do whatever you want.
Yeah. So this is a great question because judging by my replies on social media, this is the number one objection to being upset about any of this is that CDC screwed up during the COVID pandemic. There were masks, Operation Warp Speed, vaccines, yada, yada, yada. You lost trust. We don't trust the CDC anymore. Good riddance. Or let's build something new, and then that'll be so much better than the old CDC that failed at so many different things. While it's true that the CDC is not a perfect organization, we are actually losing things that are extremely basic and that will result in a lot of people dying. So, whether the CDC screwed up or not during the COVID pandemic, which of course they did, all of us did, everybody working in public health and science did, the CDC actually does a lot of stuff that most people don't think of from day to day. So, for example, let's talk about avian flu. For example, H5N1. So H5N1 is all over the place. It's everywhere. Right now, there's 42 different confirmed poultry outbreaks in the U.S. And this virus, basically, the only thing that's preventing it from becoming a pandemic is the fact that right now it can't transmit from person to person efficiently. So in the past, and last year, I had a front row seat to this because I was invited to these expert briefings that were put on by the CDC and the USDA about the avian flu response. So I could actually see what they were doing for all of this. There's a lot of behind the scenes work that goes into preventing something like this that's an emerging threat from actually becoming a pandemic and killing a lot of people. And one of those things is just basic surveillance. So we can't respond or do anything to diseases, and that includes not just H5N1, but also seasonal flu, outbreaks of foodborne illnesses, things like that. You have to do surveillance for these things so that when there is an outbreak, you can catch it early and basically prevent it from happening. And there's a lot of different ways to do that depending on what type of outbreak it is. So CDC was normally doing this, and importantly, so were a lot of state and local health agencies. CDC's role, one of their very important roles, is to actually coordinate with these state and local health agencies to compile all that data in one place so that then the CDC can respond to it federally. And if you have something like a pandemic that is starting, you have an outbreak of something that could become a pandemic, you really need to have that national capacity to investigate and to coordinate containment efforts, especially if it spans multiple jurisdictions. So we're not going to be able to do any of that stuff anymore. If you have a pathogen or an outbreak that can be controlled with vaccination, so for example, the measles outbreak in Texas, some people who were actually responding to that measles outbreak were rift in this past round of cuts. You will not be able to actually reach the people who have this virus spreading around between them. You won't be able to control the outbreak. It gets bigger and bigger. And in the case of measles, you end up with more and more dead or permanently disabled
Let
children
me
as a result.
let me ask the question. Let me ask the question this way. Um, I was talking about you with someone, of course, for everyone who's with us, Dr. Rasmussen is involved, along with myself and others as part of the Save America movement. You can find the website, the saveamericamovement.org, and we'll talk a little bit about that, maybe as we get to the end. But suffice to say, we're building an opposition committee. There's elements of politics, and you are one of the public health experts, one of the preeminent virologists in the practice, and you're involved in this, very, very concerned about it. And I was having this conversation with one of the people who's involved, who spent most of their career in politics. And you go, like, I really love Angela. She's great, really smart about politics. And I go, she is like really smart about politics, which is amazing because she's so brilliant. And it's really hard for brilliant people to comprehend how stupid it all is, right? Like at the core level. So I'm gonna put like a really simplistic frame on this, but I think this analogy works. Let's say casual observer looks at what happened at Afghanistan at the withdrawal. They say the army really messed this up, and therefore we should get rid of the army, right? Because the desire to get rid of CDC, get rid of the army, I think is the same basic thing, except I think it's a lot easier to explain what it is you need the army for and what might the consequences be if you have no army. So is it fair? Has anyone ever asked Trump a question at the core about the Centers for Disease Control. Has anyone ever attempted to just neutrally ask them and say, "Do you know what the CDC does? Do you like the CDC?" Right? That does he associate it entirely with Fauci? What has anyone ever done that? Attempted to do that to your knowledge?
That's a really good question, and I don't think so. Not since prior to the pandemic. So in 2017 or 2018, Trump wanted to impose big cuts at the CDC because he thought that in the first term, he thought that it was basically a waste of money to be engaged in any kind of pandemic preparedness work. That didn't go through because Congress had historically CDC and all the other HHS agencies did enjoy pretty broad bipartisan support. But that was, to my knowledge, the last time that prior to the pandemic that Trump talked about the CDC in terms of how he saw it sort of fitting into his administration. I don't know that that's actually been brought up recently, other than with Secretary Kennedy talking about how corrupt the CDC is. And most of that is driven by what Kennedy says about it. So I actually don't know what his response would be about it. I'd be very curious to hear.
Now, going back to the analogy about the Army, Kennedy is the guy who's saying, "We're going to get rid of the Army because the Army is bad, but don't worry about it. I got something that's a new Army."
Yeah.
And you say, "Well, okay, what's the new Army look like?" And the new Army doesn't look at all like an army, any army, army anywhere ever. So what is it that Robert Kennedy wants to do? What is he trying to achieve? So, for example, um, I understand perfectly the transaction between Christy Nome and Pam Bondi. They're both unfit. They're both unqualified. No one would ever appoint them to any position of responsibility ever, especially Bondi. Nome is a complete psychopath. And the deal with the devil is she gets to run around the country with her boyfriend, Corey Lewandowski, playing dress up and ordering people because she's sadistic, for example, to shoot pepper balls at the heads of priests. And she gets off on that. She's a sick woman. She shot her dog Cricket. Right? She's fucked up 7 ways to Sunday. Right? But that's very easy to understand. Pam Bondi is ludicrous as the attorney general, but he made her attorney general. So she's a person who shows up with insult cards to the hearing, right? Again, right? Simple transaction. What is in it for Robert Kennedy? This is the most psychologically interesting one of all of them, complex. So you blow this up to what end? And then again, without giving the scientific answer, what I'm trying to push you on is it's gone. It's gone. It's gone. It's Angela.
Yeah,
It's gone. It's gone.
it's gone.
Right. It's gone. It's all gone. What happens then? We have 800 people right on with us. As simply as you can. Why should they care? And then the next question I'm going to ask you is if, in fact, you say that the function is irreplaceable, I want to talk about what California and New York and some of these other states should do. But again, so what? What happens?
Yeah, so in your analogy, comparing it to the army, it's the same purpose. This is why people should care because the CDC prevents Americans from dying. It it will literally kill people to not have the CDC present. Just like if the Army is not present to defend American security and America's interests, people will die as a result. So that is the purpose of the CDC. It is to defend Americans against threats to their health, and it is to save American lives and provide these essential government services, just like the Army does. And, the Army doesn't only fight wars. The Army does a ton of infrastructure work and other things to make sure that any security that it achieves is long lasting. And that's what the CDC does as well. It just does it in the public health space. And in fact, there is actually a branch of the military, the Public Health Service, that is embedded within the CDC. So that analogy is even more accurate. Now, in terms of Kennedy, um, I agree with you. I think he is a very interesting psychological study. And as far as I see it, there's really two things that motivate Kennedy to do all of this stuff. The first one I think is pretty easy for people to understand, but not a lot of people have really grasped this and to the extent that this benefits him financially extraordinarily. Kennedy has made millions and millions and millions of dollars over the years as an anti-vax advocate, pushing all of this wellness stuff, selling supplements, essentially selling snake oil to people at the expense of their health. So that one's pretty easy to understand. The second one I think is a little harder. And that's because he is a true believer. He is a zealot in terms of being anti vax. He truly believes that vaccines are bad and they kill people. On top of that, he has said on more than one occasion that he essentially is very supportive of different types of eugenic based strategies. So, for example, during his presidential campaign, he said that SARS-2 or COVID-19, the virus that causes it, was engineered to spare Han Chinese people and Ashkenazi Jews at the expense of white people and people from other racial groups. It is not possible, actually, to make an ethnically targeted bioweapon, as he claimed. Claims like that are essentially just really trying to get these pseudoscientific eugenics based ideas ingrained in his followers. And unfortunately, I think it's working in many cases. He actually would like people, I think, to die from these preventable diseases, from these vaccines that he's going to take away, because that furthers his notion of a eugenically shaped world.
So if you think about the CDC in terms of this analogy, which is that on the first attack on the World Trade Center in 1993, the World Trade Center survived that attack. It was damaged. World Trade Center did not survive the attack in 2001. It was obliterated. It was gone. Um, the aircraft carrier that Trump recently posed on has a big hole on the bow. They covered it up with a flag from an accident, but it's good to go. It can sail. How much damage are we talking about to the function of the institution on a 4-year basis? Certainly everything that Trump is doing is not good, but um how do you evaluate or predict the total of the harm? Will it be the case that it doesn't exist at all? That it can't do any of the things that it did? What happens?
So I think the CDC is going to continue to exist as an entity. I think so. Right now, let me just also give you some background before these rifts happened. There have been two other major rifts throughout this administration. I call them the Valentine's Day and the April Fool's Day massacres, in which a number of people were left, basically. Some of those people have been reinstated. many of them have been kept on administrative leave and actually not brought back to work. So those functions were already severely depleted. Many other people have voluntarily left the agency. They don't feel that they can continue working there and continue to fulfill the agency's mission. Many people also took the so-called fork in the road that DOGE was encouraging people to take early on. So there's already been quite a lot of attrition throughout the agency, and agency functions have been severely impaired. Talking to my colleagues who are currently working at the CDC, one of them described their job as, quote, finding bureaucratic cheat codes to be able to carry out the most basic functions of their role. So already the CDC, prior to this round of rifts, was really depleted and not able to do a lot of the things that they were doing before this administration took over. Now with these rifts, I mean, basically, this is the equivalent of closing down entire offices at the Pentagon and removing functions from the Army. Now, that said, the CDC as an agency has a lot of clout, and I suspect that Kennedy and the administration is going to present this as some type of reform, some type of needed structural reform where we're going to make the agency work better. But what they're actually going to do, I think, is replace some of these employees that have been riffed, particularly in the office of the directors, with political appointees who are going to, instead of doing their jobs, they're going to say that they're doing the functions of those parts of the CDC, but they're actually going to be continuing to carry out the MAHA agenda, which is decidedly anti-scientific, and it's going to take vaccines away from people. It's going to compromise our privacy. There are currently, and we can certainly chat about this, there are currently contracts with contractors like Palantir where they could have unprecedented access to American health data. We won't be able to collect disease surveillance data for anything, not just outbreaks, but for things like chronic diseases, diabetes, stuff like that. Basically, we will have political appointees saying that we're doing these things, but they won't actually be happening. And so we'll essentially have a CDC that isn't carrying out these public health functions, and state and local agencies, as well as other academic and medical groups and things like that, will have to step in and try to fill the gaps.
So that's where I was hoping you would go. So there are 40 million Canadians. Is Canada impacted by collapsed American CDC?
100%. So this is something I get asked about all the time here in Canada. This year in Alberta, we had a measles outbreak that is still ongoing, actually, that's larger than the one that happened in Texas. That's largely because Alberta's premier, Danielle Smith, that's like the governor of Alberta, has really embraced a lot of the same ideas as Kennedy in terms of being anti-vax. So if there's a big measles outbreak in the US, that means it can come to Canada, vice versa. These viruses can easily spread back and forth across the border. And even if we're tracking things in Canada, which we still are nationally, the Public Health Agency of Canada, the Canadian Food Inspection Agency, is actively responding to all of these types of threats in Canada. That doesn't change the fact that if none of this is happening in the US, that still continues to put Canada at risk. And as you pointed out, Canada is a much smaller country than the US. Canada has historically relied on the US for many, many different aspects of public health, including vaccine manufacturing, including working with a lot of the vaccine manufacturers who predominantly make vaccines in the US or in other countries. Canada really is still dependent very much on the US having a functional public health system. And many other countries around the world are as well. This is going to be a problem for virtually everybody. It's not just an American problem.
Does the US have a functioning public health system?
Well, I think it's really unclear right now. We certainly have state public health agencies that are still functioning. The CDC is, I guess it will be seen after this weekend how this is all going to work out. But the CDC was barely functioning. Many of its normal essential functions have been either dramatically scaled back, or in some cases, offices have been closed completely. The things I'm looking at are things like seasonal flu surveillance. So we're right at the beginning of flu season. This is not just H5N1. This is H1N1, H3N2, and the normal seasonal flu that circulates in humans. CDC tracks that very carefully through partnerships with state and local health departments. Whether they'll even be able to compile that data in their weekly situation report remains to be seen after this week. I think that there's really a lot of confusion about, say, the Morbidity and Mortality Weekly Report, whose entire staff was riffed. That publication has, for the most part, been put out weekly for the last 60 years, with one brief interruption in February of this year. The MMWR previously was the first to report the HIV epidemic when it came to the US. It was the first to report the 2009 H1N1 pandemic. It had some of the very, very early important results about transmission without symptoms for SARS-2. So the MMWR has been historically a really, really important means of getting public health information out there for both the US community and for the world. And that type of thing is going to be gone. Supposedly, the MMWR staff is going to be reinstated, but as far as I know, they've not yet received notice that their RIFs were in error. So functions like that really have a huge impact are going to continue to go away. And we aren't going to necessarily have federal public health capacity, or at least we won't know about what our capacity is because the CDC is not really able to communicate that anymore, and there's not enough people to carry out many of these functions.
So I so what here's something that I don't I don't there are, to me, only three ways to think about this. The the first is, you can say they're terrible and these people are crazy, but science is science and the institution is the institution. And downrange, if you're getting cancer treatment at Sloan Kettering, your patient experience and the excellence of your physician is not impacted by the insanity of Cali means. And not to discount that they're going to do damage, but the ability to eradicate the public health industry, service, practice, however you think about it, in the country is overstated. They'll be out, and we'll come back and everything will be fine. So it's either that, or two, it's been very severely degraded and damaged um in a way that requires the construction of something to replace what's gone. In that circumstance, if you're an advisor to the Canadian Prime Minister, if you realize that Canada, from a brand equity perspective, is the most trusted brand in the world, and it's the number one most trusted brand by brand identity with Americans. It's a high trust brand, high standards. And you had a Canadian standard established across public health. And you had a state like California adopt the Canadian standard. And Massachusetts said, you know what, we adopt the Canadian standard. And by the way, we're going to establish an interstate compact of states with a shared standard. We're going to stop fighting the diabetes belt, the obesity belt in the United States. We're gonna stop waging public health war against the unhealthiest places in the country that now offensively, beyond not just stewing in the lack of public health for their citizens and higher infant mortality rates and obesity rates, are now trying to impose it on everyone else. We're opting out. California is the fourth largest economy in the world. It is an incredibly wealthy state. Canada is a profoundly wealthy country. The United States, over our lifetimes, has been the tip of the spear of forward scientific progress in space and aerospace and engineering and computers and technology, in medicine and science. And that has been attacked, it's been assaulted. And I think a lot of people in a lot of states have to give consideration to that they want to live at the whim of the risks imposed upon them by the most ignorant people in the country. Is that not a fair way to think about it?
I think that's a very fair way to think about it, and I think that really right now, that's kind of all that people in the US can do to respond to this, is these multi-state coalitions that are gonna try to replace some of the function of the CDC. So I'm a resident of Washington State. I'm from the Seattle area originally. Go Mariners. Don't tell people in Canada I said that. But, you know, my family, my residence in the US is supported by this coalition of Western states that has come together. And I think, you know, it's necessary to have something because we can't not have public health. In the days before we had public health, and this goes, you know, way back 100 years, more than 100 years ago, we had people, you know, life expectancy was I'd probably be considered very old and lucky to be alive in my mid 40s, with the standards of health that were available at the time. It was essentially every person for themselves. As a society, you know, over the last 150 years, we've decided that it is a priority to have things like, you know, clean water, clean air now to a degree, safe medicines. We've decided that vaccines were helpful because they prevent so much illness. All of those things are essentially going to go away and it's going to go back to being every person for themselves. So I think it's great that state governments are going to step in, especially powerful, wealthy states like California. I think that, you know, we have to have something in place. But this would be, to go back to the earlier analogy, this would be like trying to replace the entire US Army with the California National Guard. It can fulfill many of those functions and it can do so for people locally. But the whole reason to have a federal agency in charge of this is to coordinate the needs of the entire nation. Because just because somebody lives in the diabetes belt, which is now also becoming the go to jail for having a miscarriage belt, and a number of other health horrors belt, do those people deserve less of a public health standard? And I don't think that they do. I mean, you know, I think that in America, in developed nations, there should be a national public health service. And for us, that has been the CDC. The CDC was really, as you put it, the brand standard. It's the most recognizable brand in the world, the most trusted brand, and other countries have developed their own public health systems around the CDC. It's really difficult to replace everything that they offered in terms of government services to taxpayers. And I think that, you know, we have to have something. So I am glad that these state coalitions are forming. I'm glad also that some of the professional societies, for example, the American Academy of Pediatrics, the American Medical Association, these are bonding together also to do things like make policy recommendations, so that people can actually provide their patients with a standard of care that's evidence based. I think all those things are good, but they're stopgap measures. They don't replace what is going away.
Do you um first off, let me say I agree completely that the whole country deserves world-class public health, but sadly, that's not the country we live in, and choices have been made. So I want to think about we I don't think even you in your most pessimistic are prepared, though I push you into that to space to say the CDC will be destroyed over the 4 years, but you are prepared to say it will be damaged.
Oh, I'm prepared to say that it'll be destroyed. It'll still be
Okay.
there. It will exist. The CDC will exist. It's just gonna be filled with anti-vaxxers and people who are giving the most unbelievably dangerous public health advice, and guidance and providing essentially
So
no
something
useful
so
government
something
service.
new will need to be rebuilt and will need to take its place.
Yes.
It will not be savable. I would put ice in that category.
Yes. I
Okay.
think that the CDC is gonna be a little bit different than ICE because, ICE, I think, is completely unredeemable, and it's essentially, state police. But the CDC is not necessarily going to be that. I don't know that the brand will be so tarnished, but what's going to have to happen, depending on how all of this goes, is that all of these political appointees, right up to the current acting director of the CDC, Jim O'Neill, are going to have to be removed because the people that are going to be installed into leadership positions at the CDC that have now just been liquidated are going to be the worst imaginable people for public health.
W- What about this idea that the state of Georgia, in whatever comes next in the history, the future of the CDC, that Georgia, the state of Marjorie Taylor Greene, is the wrong place for the CDC to be located. That the CDC should be located in an American jurisdiction that's science friendly. So it doesn't have to be in California. It could be in Colorado. It
There
could
is actually a
be
CDC branch there.
it could be in New Mexico. It could be in Washington State. It could be in Portland.
Yeah, I think that that's the case. So historically, the CDC was placed in Atlanta. It's actually really interesting that you raised this because the CDC started off really as an office that was devoted to malaria control for the Army. And the reason it was in Georgia was because that's where we had malaria back in the day in the US, coming back also. But one of the reasons they decided to keep the CDC as it was being built out into the federal agency that it is now in Georgia, in Atlanta, was to keep it away from Washington so that it wouldn't be unduly influenced by politics and that it would exist solely as a federal agency that was devoted to science and public health, and made decisions and policies based on evidence without too much interference from politicians on the Hill. I agree with you, though. I think that if there is going to be more of a state involvement in the CDC going forward, it absolutely needs to be in a place where the political environment is such that there's not going to be a ton of interference. Right now, though,
Massachusetts.
oh, I was gonna say right now, I'm just not sure how much of that is actually coming from the state of Georgia. I think, a lot of the changes that have happened at CDC, for example, with, vaccine policy recommendations, has really still been coming from Washington and from Kennedy himself.
When you think about the possibilities of a state system that imposes high standards and sets a scientific standard, and the federal standards on all of this stuff have lost meaning, doesn't that at some level just reset the cycle going back all the way to 50 years ago with consumer warnings and everything else? The whole deal that before there were scientific warnings, there were none. I have a collection of old advertisements on my wall for all manner of products that, from, Camel cigarettes, doctor's number one recommended smoke,
Yeah.
right? And then science intervened. Do you have a sense about how scientific skepticism works its way out in a society when there's some type of panic like this? Is there historical analogs to it? Is there, anything anywhere? I mean, because the 20th century is the century of science. Everything before then, was a lot more similar than it was dislike. And it just seems that we haven't lived in a scientific era long enough to comprehend the rise of the Luddites within it and what happens. Am I missing any part of, is there an example anywhere to look at, or
So I think about this all the time because to me, that's the real issue here. The issue is not that, CDC was doing bad science or whatever. The issue is actually, and really the issue is not even that the public has lost trust in the CDC because they fucked up during the COVID pandemic. The real issue is that the public has lost trust in the CDC and in public health because the people in charge of them have been lying about them for the last 5 years, and they've been extremely effective at their propaganda. One thing I was very disturbed to see over the weekend is that a number of government websites, including the CDC, now have these disclaimers at the top of them that say that they are no longer being maintained because of the government shutdown led by the Democrats. The USDA's actually explicitly calls it a democratic shutdown, and I think even mentions Chuck Schumer. Um, it is not normal to have the government putting disclaimers like that on government websites that contain scientific and medical data. And so the only historical example, with the caveat being that I'm not a historian, that I can think of that's most parallel with this is Stalinism and Lysenkoism. And so, what happened briefly in the Soviet Union in the end of the 1930s, or actually the beginning of the 1930s, was Stalin was forcing everybody into these big collective farms. And factories, and there were huge famines. And so this guy Lysenko basically said, "I've invented a new method of growing wheat, and we're going to be growing wheat in Siberia, and like we're going to, have the Soviet Union is going to be the most fertile land in the world, and everybody's
Mhm.
going to be full and happy and laboring towards the collective good of society." Well, that didn't happen. Lysenkoism was basically a big lie. And yet Stalin made it his central thing for agriculture and science, to the point that Mendelian genetics was actually banned in 1949 or 1948, and many of the scientists who were working on the authentic science, which was Mendelian genetics, were either executed or sent to gulags. And a big part of that, the whole reason that this was able to happen and why it happened for a period that lasted almost 20 years, was because of the amount of propaganda that was shared. And I think right now, it's been very interesting because when I tweeted about the CDC being eviscerated on Friday night, I just shot off a tweet really fast based on what my friends were telling me. I've gotten, like, it went viral, and I've got like 25,000 likes or whatever. I've got thousands of replies. So many of them are all from the same playbook. You guys screwed up COVID, vaccines don't work, I hate your masks, like blah, blah, blah. The same thing over and over again. Like, this is a really, really well organized, well executed propaganda campaign. And now the administration's in on it, which I find unfathomable as an American, but it is our reality. And I've started to actually think of this now as a battle for the public understanding of what reality even is. I think that the real problem that we're going to have to deal with the CDC and probably many other things throughout the government when this is all over, is trying to figure out how to undo the damage that all of this propaganda has done, because that's really it. Vaccines, Operation Warp Speed saved millions of people's lives in America. You wouldn't know that, though, from hearing from the people who actually ran Operation Warp Speed, who are now saying that they're the most dangerous things in the world and people shouldn't take them.
It's a great paradox in all of this, and we should talk about it the next time you're back, because that's just where you said is such a perfect way to leave it. But one of the things that Democrats are going to have to grow comfortable with in the years ahead, in the aftermath of this, is to restrain the impulse to do more and to be in favor of doing less much better, because there is no reset to what they burned down, and there is no construction that will rebuild what's gone overnight. And so, in consideration of what comes next, in a world where no one believes anything from anyone about anything, up can be down, left can be right, all of it, do less and perform against that instinct to do more is going to be an incredibly important tension for Democrats to work through. And thank you, everybody, for joining. Another great conversation. 3-time guest, Dr. Angela Rasmussen. She's going to make it back for 4, even 5. And thrilled to see you again. Have a great week, and go Jays. And we'll see you again soon, Angela.
That sounds great, Steve.
All
Thanks
right.
so much for
Bye
having
bye.
me.